We have Ms. Alexandra Machado from the IFRC. She's the global lead for water and climate with over 20 years of combined experience in Africa, Southern America, and Asia, where she has gained a variety of skills in the areas of resource mobilization, project proposals, delivery of technical assistance, as well as monitoring and reporting of development projects through different Red Cross and Red Crescent national societies and other non-governmental organizations. Ms. Alexandra holds a bachelor's degree in engineering and master's degree of science, technology, and water resource management. In her current position, her main objective is to provide technical support to RCRC national societies to strengthen their capacities, strategies, and activity plans in response, preparedness, recovery, and development in water, sanitation, and hygiene, with strong emphasis in public health, climate change adaptation, hygiene promotion, and emergencies. Ms. Alexandra's work in crisis zones ensures dignity during emergencies. To dive deeper into this, I'll pass it on to Ms. Alexandra.
And thanks so much, Dr. Veneta, for the invitation to IFRC to be a panelist, and very, very nice to see as well Ina here in this nice webinar, and other colleagues that were so hard and have recent years effort even for the menstrual hygiene landscape. We are very happy as well because with Asian Technical Institute, I think we are going to have as well an agreement. So this is really as well very good effort, and as well we have collaborating with Watch United since long time, so it's very nice. And I go back to what Ina was discussing before on how different the landscapes looks today than before, right? For Federation, International Federation of the Red Cross, we have been quite active only till the beginning, but in the beginning was very small amounts of activities and very concrete in some national societies only, more in East Africa. By the way, I hope everybody knows, but Federation is the secretariat of 191 national societies. These national societies are auxiliary to government, and this is why we are, when I'm talking about Federation, I'm talking about these 191 national societies around the world that are doing an excellent job in health, WASH, and as well some concrete examples from menstrual hygiene management. So as I say, in 2030, from 2014, we started with operational research on East Africa, where we were giving pads and different type of pads, reusable, disposable pads, kits. And from there has been a big, change. In 2017, when the full toolkit was done from Colombia, we saw really an opportunity that our national societies really adapt the guide and tools. So our first branding Red Cross and Red Crescent guideline was in 2018, but from there we didn't stop. Why? Because, as you know, this was in English, Arabic, Spanish, and French, but we need as well in Asia is a totally different context where many national societies works with the community in different language. So we have been doing a great effort in having the translations in Bangladesh, in Myanmar, as well in Indonesia, where we have as well in different languages, in Philippines as well. So we didn't stop in having in the full language that are normally officially for Federation. We are really looking for adaptation at country level. So now We will, afterwards as well, I will share the link where you can find all these tools. We are making the tools as well available. We have an open sources, so any of you other organizations who want, or students who want to really, download the guides, the tools, and as well IC material, can really do that. We don't work only in emergency situations. We, as national societies, for example, Thailand Red Cross, work in Thailand before the emergency, during the emergency, and after the emergency. So we use this opportunity as well to have long-term approaches, right? Not only we work in preparedness, we work in the response of disasters, but we have as well, we stay there after. So this is a big opportunity for us as well to work, and as Sina mentioned, to try to advocate more. We are not so much in advocating to government, but we work with government together. So I think it's a very important point. We are more operational. We are more the people that go there and distribute items that rehabilitate toilets, and as well bring the water part of it to the menstrual hygiene. But it's very important as well, like Ina suggested before, to have a dialogue with the government, to be there to adapt the tools to what the government, Minister of Health, are looking for. And this is what we as well can support. We have translated, as I say, to many of these and adapted, but we as well tools. So please, I will share the link when I finish my presentation. But as well, we have concrete actions as well in different emergency situations. So, for example, we are working in Bangladesh since 2017, and what is as well very important is to have really the community engagement and accountability. And this is where coming our volunteers. Our volunteers work, understand the language, but not only the language, understand as well, the taboos, understand as well the challenges that girls and females have around the world or in concrete countries. So I wanted as well really to emphasize that, because there is a big work on community engagement as well at community level. And it's as well very important not to think only on the items that we are distributing, but as well, the privacy and safety and dignity for the wash infrastructures that we are constructing, beside of the menstrual hygiene kit item adaptation. Yeah. This is an example from Asia. We have as well in Afghanistan, as I say, work in schools. It's more a long-term project where we, since 2020, we are in 31 schools, reaching as well different activities like building knowledge, addressing cultural beliefs, lettering blocks, as well in menstrual hygiene rooms, and as well the distribution. But exactly, these are the three components that I want to highlight. When we are working as Red Cross, we see these three components need to be at the same time, right? It's not only, and I really want to emphasize, it's not only on distributing hygiene kits that we should work on. Okay, and I think I stop there. We have many other examples. We will share the link to our website where you can find different examples. This is from Americas. We have from Africa and from other continents. But I think, Dr. Vineta, I leave my presentation here and happy to answer any question.
Thank you, Ms.